A major milestone in China's battle against the coronavirus. For the first time, no new cases have been reported in Wuhan, the epicenter of the outbreak. The city battled thousands of new infections daily at the peak of the crisis. But medical teams who were deployed from across the country are now returning home. Chinese scientists and health experts believe the worst is over.
我觉得看到这个双零增长的话，我们心里边也是感觉非常的高兴。那么说明我们这么多天的努力呢，终于我们今天开始见到了曙光。说明我们这些防控的措施和我们这些诊疗的策略，应该说都发挥了重要的作用。
The new challenge for China is a rising number of infections from abroad. All of today's 34 new cases came from overseas, mainly people from Britain and Spain. And Olivia Xiong has been following the developments in China. She joins us now. So, Olivia, the strict measures by the government, have they paid off?
Well, it definitely would seem to be the case. This is a major milestone for China and a major milestone for Wuhan and Hubei, especially since they've been the hardest hit during this outbreak. And we know that Wuhan, a city of 11 million people, they have been under lockdown since January. And that has meant that, all flights and railway trains and transport into the city has been, in and out of the city has been suspended. Public transport within the city suspended as well. And today we are hearing that some of these quarantine restrictions are being eased. Local authorities saying that if a residential community has been found to be infection-free, residents can restart their personal activities within the residential compound, though this is to be done in a staggered manner, and group gatherings are still not to be allowed. Now, if these residential communities can be infection-free for a week, for 7 days, then some shops that operate within this residential compound or small supermarkets can then reopen and restart their operations if they were to take the right precautions. Now, what health experts in China are saying is that if the lockdown in Wuhan can be gradually lifted, if there are no new cases for 14 days, but there still needs to be strict precautions and prevention and control measures taken to prevent a second wave of infections, so to speak.
Olivia, the doctor who first sounded the alarm on this virus, he was taken to task. We know that. A report surrounding the issues has also been released following investigations. Can you tell us more?
Yes, this report has just been released to the public a short while ago. This after the National Supervisory Commission was sent in to investigate after there had been an unprecedented outpouring of anger and grief with the death of Dr. Li Wenliang, that Wuhan doctor who was among the first to sound the alarm of a SARS-like virus in December, but had been among those that had been reprimanded by the police for spreading fake information on the internet in January. And Dr. Li died early last month of COVID-19 and has become somewhat of a hero and a national symbol during this period as China has dealt with this outbreak. And his death had also led to calls for more freedom of speech in the country. And today we are seeing authorities release this report, and the investigations have shown that authorities are saying that it was not right of the police to have summoned Dr. Li or issue this reprimand letter, a letter that has been circulated widely on Chinese social media. Authorities are also saying that what the police did was not in line with law enforcement standards. And the investigation team has said that the Wuhan disciplinary authorities should get the police to retract the letter of reprimand and hold people responsible, and so that the people know of the outcome. Now, netizens on Chinese social media site Weibo are saying that it's good that the investigations have these results have been released and this investigation was done, but it's also, some of them are also saying that this was a very painful lesson for China to have learned.
Olivia, how is China dealing with the new influx of imported cases, 34 from overseas, mainly from Britain and Spain?
Yes, so Beijing has seen an influx of imported cases. In fact, the number of imported cases in Beijing makes up the bulk of the country's imported cases, and we have seen the capital stepping up measures over the last few weeks. Just a short while ago, it was announced that from tomorrow, some international flights into Beijing will be diverted to nearby cities like Tianjin, Hohhot, as well as Taiyuan. Now, passengers will go through a screening in these nearby cities first, as well as clear immigration there. And if they are found to be clear, then they will be able to board their original flight and be flown to Beijing. Now, this will be affecting only some of the flights of Chinese carriers for now. And the reason for this, well, a China Daily editorial had previously said that this suggests that Beijing may have reached its limit in screening incoming visitors. Now, over the last few days and weeks, we've seen as the focus has shifted to imported cases, Beijing has put in place more screening measures at the Beijing Capital International Airport. There is a special zone for all international flights. Passengers then have to undergo health checks and are sent to a transfer center where they will then be sent to designated places to undergo a compulsory 14-day quarantine. Now, previously, incoming travelers were allowed to, self-quarantine or at home if they lived alone, but this is no longer being allowed. You have to note that China has not closed its borders like other countries. It's still saying that if there are effective measures in place, there is no need for that. But China is really facing a problem. The China Daily says that there have been about 120,000 arrivals in China every day over the past week, and half of them are from hard-hit regions. Many of them are Chinese who have been living or working or studying overseas, and now they are returning to China, which is regarded as a safe haven for them. And so that's why we are seeing Beijing and other parts of China really stepping up measures to guard against these imported cases.
All right, thanks for that update. Our correspondent Olivia Xiong there.